So asthma is a disease that involves inflammation of the airways. So the air that we're breathing, whether we're indoors or whether we're outdoors, obviously has a tremendous impact on asthma and how it presents itself in terms of symptoms and exacerbations or attacks. And so this year we've had some increased challenges over what we would normally see throughout the course of the spring and summer because of the wildfires and the smoke coming from those wildfires and traveling great distances, even into parts of Ontario and throughout the rest of the country where we don't normally see that sort of impact. So the fine particulate matter that is released through wildfire smoke settles deeply into the lungs and can have tremendous impact in terms of aggravating people's symptoms with asthma. And in fact, we've had a twofold increase in the number of inquiries that we normally see this time of year from patients and families who have questions and are looking for support. And we know that a lot of that is related to the wildfire incidents that have been happening, and continue to plague us throughout this year. So that's one factor. Air pollutants in general are certainly a factor that are always of concern for people living with asthma and other lung health conditions. Uh, Pollutants caused by vehicles, through industrial processes, other sources, all of those can exacerbate asthma symptoms and increase the risk of developing asthma. In addition to that, we're dealing, of course, with the effects of climate change. And we know that climate change can impact asthma rates by altered weather patterns, increasing the frequency and the intensity of extreme weather events like heat waves and storms. These can all affect the distribution of allergens and can really lead to more exacerbation of symptoms as well. Allergens themselves are an issue for people living with asthma. Exposure to pollen, mold spores, dust mites, and pet dander and other allergens can often lead to a trigger of asthma symptoms. And those are things that people need to learn to control as well as they can in their own environments. In addition to outdoor air quality issues, of course, the air that we breathe indoors also has an impact on asthma. So indoor air quality through obvious factors such as tobacco smoke, but also less obvious factors that can have an impact on the air that we breathe in our own homes, such as certain types of cleaners and other uh, deodorizers and things that people use really without thinking about the impact that those products may have on their asthma and their lung health in general. And then, of course, viral infections, which are an issue that often can trigger asthma symptoms and asthma attacks. There are other factors, occupational exposures and psychosocial factors. Stress can impact asthma as well. But those are some of the main factors. And really, we think a lot of the increase, this in particular with this year, is because of the impact of these climate related events as well as the wildfires.